On behalf of the Children's Oral Health Coalition, I would like to welcome you to our Growing Healthy Kids from Pregnancy and Beyond. This series is monthly conversations provide a unique opportunity for new and experienced parents to gain the skills, the knowledge, and the awareness about a kid's oral health, overall health, and well-being. Our goal is to help parents by providing access to the providers, tools, the resources, and topics that are difficult to have as it relates to growing up kids to be healthy. Today, we will be talking about getting all aboard for child safety. We have a panel of rock stars who will share tips and insight on how to keep your child safe no matter where they are, at home, school, childcare, in the car, near water, playing sports or on the playground, watching TV, using social media, or even when they're sleeping. Thank you to our moderator and panelists for joining us tonight. We're excited to have you. So let me first introduce you to our moderator, who is Amy Johnson. Amy is the program coordinator at the Center for Children's Health. We also have Dr. Daniel Guzman, who's the pediatric emergency doctor at Cook Children's. We have Elizabeth Petty, Public Health Education Manager with the North Texas Poison Center at Parkland. We also have Dr. Christina Robinson. We also have Dr. Tanya Fuquay, Director Oral Health for the Center for Children's Health. Thank you again for joining us. And I am going to turn it over to Amy.
Thank you so much, Elaine, for giving me the opportunity to join in on this conversation tonight. So many great and important topics that I think we're going to discuss tonight. Like Elaine said, my name is Amy Johnson, and I am one of the coordinators of our injury prevention team here at the Center for Children's Health. And we focus on child passenger safety, drowning prevention, gun safety, poison prevention, and safe sleep. And all of those topics are going to be mentioned and discussed here tonight. Our first panelist tonight is Dr. Guzman, who Elaine already told us is a pediatric he's a pediatric emergency room physician at Cook Children's Hospital. And Dr. Guzman brings a unique perspective to injury prevention as an ER physician. And so we're so thankful to have him as part of our team. And just so thankful that you're here to join us tonight, Dr. Guzman. So to get us started, can you give us a little insight to kind of what initiated your passion for gun safety?
Well, so thank you guys for having me again. This is awesome to be here to be able to kind of give my perspective on what we see in the ER at Cook. We're one of the busiest ERs in the country. And so unfortunately, about 2017, I had an unfortunate incident where I had a child come in to our ER after being unintentionally shot by his sibling. And it was one of those kind of life-changing moments for me, given that I have children at home that were in the same age range, that struck a chord inside of me. And I, at that point, decided I needed to stand up, started to make a difference, not just in the ER, but in the community. And so Aim for Safety was born as a result of that day. And our goal with Aim for Safety is to reduce the number of unintentional firearm injuries in the home or anywhere else in our community, and to increase the usage of firearm safety devices. I think that's key to reducing some of these injuries that we see in our ER, basically on a weekly basis, just about.
So out of the gun injuries that you do see, are most of those from what types are they from handguns? Are they from rifles? Or are some of those from injuries that most people don't really consider dangerous?
Yeah, so we see a variety of injuries. The vast majority are related to air-powered guns, which is your BB gun, your pellet gun, your airsoft pellets as well. But we do have, and when you think about injuries in general, firearm injuries in general, the most devastating ones are the ones that are powdered firearms. So that's your typical 22, your 9mm 45. Those are the most devastating types of injuries that we see as a result of kind of the high-powered nature of those weapons. And so But it doesn't mean that BBs and pellets can't cause injury as well. And we see a fair amount of injuries to the eye. I've seen 3 kids over the course of 20 years die as a result of a BB to the chest or to the neck area. And so even though we think of these as toys, and I know growing up, I thought of them, unsupervised, and you were out there playing with them. They really have, technology has really changed what these things can do, and their rate of fire plus just the amount of pressure and force that's behind this is similar to a 9mm or 45 handgun. And so I think we have to respect these and start to teach our children early about proper supervision when they're using these firearms, in addition to kind of the etiquette around firearms and how you handle them, so they understand and respect what they are, and don't injure themselves or someone else.
So what would you consider most important for parents to know around gun safety, Dr. Guzman?
Yeah, so when you think about the number of injuries we see every year, there's about 9 children that are either injured or die as a result of firearms. And so we have 3 key messages as part of our aim for safety, and that's safe children, safe play, and safe storage. And so when you think about safe children, we think about, well, we want to make sure that we're asking other parents and family members about storage of their firearms in their homes when our kids are coming over to their homes to play for parties or for sleepovers. As I tell other parents when we have our sleepovers, is my kids are curious, and that's just part of their development. They're going to kind of get into everything. They're going to play hide and seek. They're going to move around, and so they're going to find things that we otherwise think that we've hidden really well. Kids are, they're great detectors of things that we don't want them to find. And so it's not about it's definitely about their safety practice, but it's more about the kids and their development that's going to probably get them in trouble, like they do every single day as we run around the house. And so I think it's one of those questions that we think is really important to ask. No one should ever get offended by someone asking them that question, and it should be an open conversation that we should all be able to have, especially in these times of these firearm injury and the violence that we're seeing as a result of firearms. I think it's a valid question that we need to ask ourselves and be able to talk about and it's kind of feeling comfortable and safe. The second part of that is teaching our children what to do. So safe play, right? There are folks out there who don't own firearms, and so they feel like they're immune to any kinds of injuries as a result of firearms. But our kids are, like I just said, are going to other places. You never know where you're going to find a gun these days. And so I think it's really important to teach them the basic steps of, if you find a firearm or you see a firearm, you stop, you don't touch it, you run away, and then you tell somebody. We can start that conversation really early. The maturity of your child will play into that, but you start to develop and discuss with your kids that around the age of even as young as 3, but I think 4 or 5 is a really good age to start talking about that, about what to do. And if you see something like this, you stop, you don't ever touch it, and it can be as simple as just those terms: stop, don't touch. And then the third part, which I think is huge. I feel strongly about safe storage. I think this is, as a gun owner myself, it's my responsibility to make sure that my firearm is in a place where it's not going to harm someone else, where it can't be taken by some unauthorized user. And the best way to do that is to make sure that it's locked up in a safety box, whether it's a large gun safe or a small safe, something that kids cannot access, or anyone else who doesn't have access to that, whether it's a key. And there's so many different storage devices out there. It's amazing how, technology has changed the game to some extent, where you can have your phone and you can Bluetooth and unlock a storage device, something like, you see my phone, you can see my hand, but you can do so many different things that allows you the comfort to be able to feel like, if I need to get to my firearm quickly, I can do that. But I know that 24/7, my kids are safe from accessing that firearm. And so I think that's really huge. And then definitely, when you think about just our times and now that, unauthorized access and firearms are being stolen, and all of these firearms are entering our community, that we could likely reduce, I think, our overall gun violence. And so I think those are key messages that we are trying to deliver. And we do this in a non-political way. We don't care if you have a gun or you don't have a gun. We want you to be safer with a firearm, but we want your kids to be safe, right? We want them to know what to do and how to respond. And ultimately, we want to decrease the amount of unintentional injuries as a result of firearms.
Well, you mentioned safe play. So how do you have that discussion with parents? How do they, how are kids able to tell what the difference is between maybe toy guns or real guns?
Yeah, so it's hard. We have our little placards that show BB guns and play guns and real guns, and we quiz kids about can you tell the difference between which is the real one and which is the toy, if you will, and the vast majority of people don't get it right because it's so difficult to see the difference in these whether it's a toy or real. They're made so well these days that you can't tell the difference. And so I think we've over and over have discussed that the right thing to do is not ever touch it. Don't ever think it's a toy. If you think it's a toy, it's you never know, it might be real. So adults should be the one who comes and handles that, and you should never touch it, and you should run away and find somebody. And so those are the key messages that we try to deliver to kids. That's the important thing. No matter what, you just don't know. Safest point is to not touch it at that point.
You also talked about safe storage in the home. Are there other locations that you see guns not being stored properly?
Yeah, I think the other biggest place is the cars. And so we've had injuries as a result of kids finding guns in side pockets of the car door or in kind of under the seat. And so as an adult, I think we all feel like we can outsmart our kids. And that's, we're so far behind the 8 ball on that. Kids know and hear everything that we talk about, and they know where things are. And so I think there are safety boxes that are made specifically for cars that you can drop in the middle of your console and have a lock for it. And so there are ways to be able to be safer in the car. But that's the other place that we've seen over the last 4 years where kids are being injured. And so I think it's really important that we kind of look at if you do own a firearm, look at your safety plan. Just know figure out where the risk is at, which, definitely open access to a firearm, whether it's in a car or in a home, is going to be extremely risky. And you're depending on your kids to make the right decision every single time. And it shouldn't be on them to ever have to make that decision. It should be on us as responsible gun owners and parents to do the right thing and make sure that they don't have free access to a firearm, and not think that just because we hit it really well that they're not gonna find it. So I think those are the key parts of storage that we talk about that are really important.
Thank you for that. We're going to move into car seat safety now, and you were just mentioning with the vehicle safety of the guns in vehicles. What do you see most in the ER as far as injuries that are related to car crashes?
Well, the best way to keep your child safe in a car is to have a car seat, right? And use it the right way. I think those are important parts of a car seat that keep the injuries down. When I see injuries in the ER, the vast majority are related to head and abdomen. And a lot of these unfortunate children are not strapped in. So they become a projectile in their own car, whether it's out the window or into the windshield. And so you have these devastating head injuries that are not recoverable from, unable to recover from, or they have significant brain damage that they're no longer the same child, right? And so those are heartbreaking because so many, like firearms, MVCs and the injuries as a result of that are preventable. We can do something to lessen the degree of damage that occurs to our bodies. And it really starts with making sure that our kids are proper car seat, they're facing the right way, and they stay in that car seat. I know as a parent, having 3 kids, it's always tough. You're driving, you're doing all these things. You get 2 or 3 kids, and they're kind of all over the place. And one, like my 10-year-old is likely going to try to get out of her car seat or her belt, and you're trying to manage so much, and I get that, and that makes life really tough. But we don't want to cut corners when it comes to our kids, and we want to make sure that we're doing all the right things to keep them safe. And I think that's an important part of car safety.
So what are your recommendations on how to lower that risk of injury in a car crash?
Oh gosh, well, definitely making sure that you have the correct seat for their developmental age and size. That's going to be really important, is that you look at the recommendations and make sure that you have the right seat for them. I think correct installation, which is, that's a whole other animal, right? Is you get these car seats and there's, you got belts and you got hooks and you don't know where they go. And that can be really scary and daunting. And I know, I'll give you one of my stories. We were driving back from the beach one summer, and I thought I installed our car seat correctly for my 8-year-old son, who was probably about 4. I thought I had hooked it on correctly. And I had to take a sudden stop because somebody was crossing the road. And before I know it, my son is next to me in his car seat, still strapped in, but he's next to me because the whole thing went forward. And so even as a physician, it doesn't matter who you are. These things are tough to navigate. And so I think that's really important. We have free car seat checks that you can sign up and make an appointment to get checked out to make sure that we're, installing the correct way. But I understand it can be daunting. And that was a lesson for me, right? I mean, that's really, I thought I'd done it right. And as a man, I'm like, yeah, I did it right, but luckily it's the story I can tell with a smile, as opposed to we see something out there in the world, right, where things don't go right. And it could have been a lot worse than what it is, other than my pride was hurt and my child banged his knee and he was upset and cried for about 20 minutes. So. And then I think the final thing, is that kind of correct usage of the car seat, right? To make sure, like I had them strapped in. So you got to make sure you use all the harnesses and all the straps and all the safety buckles correctly, that you just don't put them in the chair. And we've seen that, those injuries occur as well, where they're just kind of sitting in the chair and the chair is strapped down, but the kid's not strapped to the chair. Again, they become a projectile. And so that's the last thing we want to see.
It's funny that you mentioned your pride being a little bit hurt today, or when this happened. We had our first car seat check today back from COVID. So it's so nice to have that face-to-face with families again. But we had 2 dads that came in, and they were both so proud of themselves for how tight that they had been able to get this car seat, so tight that we couldn't even get it. They had to help us get them undone. So it must be a man thing, like just get it as tight as you can, right?
Yes, it won't go anywhere, right? I mean, whether it's wrong or right, I did my job. But yes,
there you go.
Again, I mean, we have free car seat checks. If there's any ever concern, I mean, please by all means go out there, make an appointment, and let's make sure that it's done correctly so that you don't have to see my face. I'm the last face really you want to ever see, because if you see my face other than on a video screen, then you might be having a bad day, and that's what we don't want.
Thank you for that great information on car seat safety, Dr. Guzman. We're going to move into water safety now. And it seems like there has been several reports about the increased number of drownings already seen this year, so early in the summer. Can you tell us a little bit about these drownings and where they're happening?
Gosh, it is definitely scary. I mean, I've been at Cook for 20 years, and we're seeing in the first part of the year, up through this month, we've already seen 29 drownings. 4 of them have been fatal. And so that's tragic and unfortunate. And it's something that we stress about in the ER all the time, that we don't want to see this. We know that the time of the year is coming around, and we know that things are people are going to get back into the water. And this is the time that we really want people to be aware about water and where their kids at. I mean, it's really important. The vast majority of drownings occur in pools, so residential pools, but we have seen an increase in kids drowning in bathtubs, and so I think that's another place that we don't think about sometimes that can be dangerous. But 1 inch of water can cause a drowning, and it can happen in seconds, and so I think that's really important for us to be aware of. And then finally, we are seeing some open water drownings. Not as significant, but we haven't gotten into the heart of the summer. I suspect that we may see more coming this summer, but I think it's really important that to be aware and know where your children are when it comes to water.
So might you be able to share some ways that parents can prevent the drownings in the locations that you just mentioned?
Yeah, so when we talk about drownings, we target the kids at most at risk, which is typically the ages of 1 to 4. Those are the kids that we see nationally that are at highest risk, and we see the most drowning. And then 1 to 14 is the second highest injury rate for children, next to MVC. So when we think about water safety and what you can do, number one is making sure our kids are wearing a U.S. Coast Guard approved life jacket. I think that's one of the most important things we can do, even as adults. I think we need to model that, right? I mean, I think, we go out to the lake ever so often, and I wear a life jacket all the time because it's easier to get into the water and you move around, but I think it helps to model for your own kids that, hey, if dad and mom are doing that, then I should be doing that as well. And so they don't feel kind of like they're left out and the ones holding the bag, if you will. And so I think that's really important, is making sure that we're wearing life jackets. That can definitely save lives. And one of the, trying to figure out, what size life jacket to put on a child or even as an adult. I mean, one of the most important things you can do is, you put that life jacket on your kid, and that thing shouldn't move up 3 inches up and down, or shouldn't go past their chin or their ears. If it does that, then it's too big, and they can easily, once they get in the water, they can slide out the bottom end. So that's one quick trick. If adults, you raise your arms, and if you're able to look side to side, and at the side of the life jacket doesn't hit your chin, then you're in the right size life jacket. And they're all weight based as well, so you can look at that on that life jacket and look at your own kid, obviously, and figure out their weight and see if that's the most appropriate size life jacket. So I think that's a really important thing. When you look at unplanned swim or drownings, at least at Cook over the last year, 60% were unplanned swim times. So that's when you thought your kid wasn't going to be close or near the water. And so that's obviously a shock and a surprise, right? And unfortunately, what I hear in the ER is I never thought it would happen to me. We weren't close to the water. We weren't having a party. We weren't doing any of that. And so, obviously kids are curious. They like to, get out and get anywhere and go places and enjoy and explore. And so this is where layers of protection are really important. So, things like fences, four-sided fences to make sure kids can't access that. Gates is another thing that's really important. Making sure you have locks on your back doors that are high enough where they can't reach and unlock those and get out there when you're, cooking dinner or doing other things, or at the front door. So you want to make sure that you're able to keep them from being able to access the water. In addition to making sure once you're done with the pool, taking all those toys out of there so it doesn't look inviting for kids to want to go back in and I want to go get my beach ball, and then they accidentally fall in without a life jacket. So I think that's another important thing that we need to be doing at home as well. And there's other things, technology is amazing. You have pool alarms. So if the water gets disturbed, the alarm will go off, it'll sound off in the house as well. That can kind of get you your attention to go check to make sure there's nothing in the water that needs to be pulled out. So I think those are important kind of places to start. But again, when we talk about water, pools, and kids, we want to make sure that we're supervising them as we can and know where they're at. We always talk about water watchers. There's always should be one person who's watching our kids, no matter what. No distractions, distraction-free time for 10 minutes of watching your kids in the water to make sure that no one's going under. And people feel like, drowning is like a Hollywood movie. People are going to be flailing and making noise. Drowning is not like that. It's silent killer. There's no noise, and kids slip under the water, and before you know it, 2, 3, 4, 5 minutes have gone by, and now you see that there's somebody at the bottom of the pool, and you're pulling them out. So that's what we're trying to prevent. And then finally, like we talked about earlier, the bathtubs. Bathtub time with your babies should be time to bond. It should be time that you're taking with that child. With no distractions, put the phone down, don't answer the door, don't worry about dinner, but pay attention to what's in front of you. You said earlier, 1 inch of water is enough for your child to drown, and it only takes seconds, whether it's the pool or a bucket or, even the toilet. I mean, these are places that we have to be aware of that we see, unfortunately, things happen. And then when you're done with that, and that's another key part of that is also, be prepared. So when you go into the bathtub, make sure you have everything you need. You have your towels and all the things that you need, because that's one thing I think I always forgot. It's like, oh, the towel. And so you step away for just a second. That's always what I hear is I just stepped away for a second to go grab that. And then you came back to a situation that was so dire. So, and then finally draining the tub. Drain the tub when you're done, to make sure that, again, your child doesn't if they love the water, they'll find their way back to it, and then they're likely to go back in there. So, but those are the key tips and messages that we're trying to provide families.
Gosh, those are all excellent tips. Thank you so much, Dr. Guzman. We've talked a little bit about gun safety tonight. We've talked about car seat safety, water safety. The next thing that we're going to focus on is safe sleep with infants. And so as an ER doctor, Dr. Guzman, what injuries do you see in regards to unsafe sleep environments?
Well, these are so tragic. I mean, these are heartbreaking. All of these, injuries that we talk about and mortalities that we talk about are heartbreaking. But when you think about a sleeping baby, how peaceful they look, how just, you love to see that little peaceful sleeping baby. And all too often, with our lives and how, tired as a mom you guys can be when you're breastfeeding your baby and spending that time that you might want to spend and just fall asleep in bed with them, right? But all too often, unfortunately, about 3,500 babies a year die as a result of accidental suffocation because they were accidentally smothered while they were in the bed with mom. And so the injuries that we see are devastating, and we want to try to minimize, obviously, those deaths and those negative outcomes.
So can you explain to us what a safe sleep environment looks like?
All right. So safe sleep environment, you can think about it like the ABCs of sleeping. And I think on our website, it says ABCs or ZZZs. And so our babies should have their own crib, bassinet or pack and play, and that thing should be empty. So the only thing you want to see in that space is your baby. And that's the best picture ever, right? It's just your sleeping baby with nothing else around them, no toys, no stuffed animals, no blankets, nothing that could potentially suffocate them. And so that's the model picture that we want to be able to see. I know it does sometimes look pretty, right? We want our babies to have all these, wonderful things, and we get all these wonderful gifts before you have a baby. But unfortunately, you need to tell people, no, I don't want anything that's going to go in my baby's crib. You can get me diapers. You can get me, these days, you can get me formula. I'll take formula at this point in time. But nothing will go in that baby's crib. And that's going to be really important. And then the second part of the ABCs is back. You want your baby on their back. That's going to be the best way to sleep. And so that they don't, roll into anything. And then again, the last thing was the crib, the bassinet, the pack and play, or a crib. That should be where our babies are sleeping, and they shouldn't be co-sleeping with us. You can definitely do kind of the room sleeping, so they're sleeping in the same room as you, but that can also be you can set yourself up for some heartache later down the road when your baby's still in your room they want to have, and you can't sleep because they're crying all night long. Sometimes they need to go into a different room. I would advocate for that sometimes. But definitely, you want to make sure that they have their own space, ultimately to make sure that our babies are safe.
Well, thank you so much, Dr. Guzman, for your insightful overviews, for the perspective that you bring, your experiences that you shared with us. We just appreciate that so much. And we just want parents to remember, and caregivers that are on the call tonight, to be aware of all these safety measures at all times. And next, we're going to move into Elizabeth Petty, who Elaine introduced earlier, who's from the North Texas Poison Center. And Elizabeth, thank you so much for being with us today. Can you explain to us a little bit about what is the Poison Center and exactly how does that work?
Hey, yeah, absolutely. Thank you for having me. So first, I would like to start off with kind of what our mission is. Our mission is to reduce deaths and injuries associated with poisonings. And we accomplish that in two ways. The first way that we do that is that we provide the poison helpline. Some of you may know us as Poison Control, the Poison Center. It is all the same, but it is the place that you can contact in case of a poisoning, which is one way we really contribute to reducing those deaths and injuries caused by poisonings. The second way we do that is through education. So by allowing us to participate in panels like this where we get to share that information. But the North Texas Poison Center is located at Parkland Hospital, and we are the place you'd call in case of a poisoning by simply dialing 1-800-222-1222. I know that number is a lot longer than 911, but it's one of those important numbers you definitely want to have at home if you don't already have it, whether it's on a magnet on your fridge or stored in your cell phone.
So what kind of scenarios can families call the Poison Center for?
Yeah, well, the very first reason you're going to call the Poison Center, one of the first reasons is if you've been exposed to a poisoning or you're concerned about a possible poisoning. So something happened, you have a question, you call the Poison Helpline. And to mention that it's a nurse and a pharmacist or doctor that picks up the phone call every single time. So a lot of people think that when they call a 1-800 number that it's a volunteer answering the phone call or a machine, but know that every single time you call, because of a poisoning, you'll get a specialist in poison information that picks up your phone call. But you don't have to have a poison emergency to call us. You can call us if you have prevention questions. So maybe you're not sure if it's safe to take two different medications together. Maybe you're a little bit unsure about dosing, right? You call your pediatrician at 9 p.m. at night. They're probably not going to be open. So we really want to assist you with some of those prevention questions. Or you can call the Poison Helpline if you want to order some educational materials. Maybe you want to hand them out to your neighborhood at an event or community fair. We provide those as a resource too. So a great number to have in your phone, saved or on your fridge.
Thank you for that, Lisbeth. So that it seems like it's a great resource for families to have, like you said, when accidents happen or it's medication related or they're exposed to something. But what are some ways that families might be able to prevent this from happening in the first place?
Yeah, and so I will mention that most of our poisonings occur because of medication. So whether it's misuse, so maybe you took too much, maybe a parent double dosed, maybe parents didn't communicate that messaging. And so one of the safety messages that we always like to relay to the public, especially when it comes to medicines, is that's our top call, is to use medication safely, use the correct dosing device that comes with the medication, store medication safely, right? We want to keep medications up, away, and out of reach of children. Like Dr. Guzman mentioned earlier, kids are very curious. So keeping products like medications or even things like household cleaners just simply somewhere high is not sufficient because kids are smart, right? They can pull up a chair, they can climb up cabinets. I have a 2-year-old who climbs absolutely everything. And so making sure we have some safety measures. And of course, disposal as well. So often our doctor might change our medications. They might be expired or unused. So we want to make sure we dispose of those medicines safely, whether it's at a permanent drop box or by participating in the DEA medication take back program twice a year.
That's great information. Thank you so much, Elizabeth. And if you want to, you're welcome to drop that important number in the chat box so parents can write that down, or if you have a website that you'd like them to go to as well, that would be great. Yeah. Coming up next, we have Dr. Christina Robinson, who is a pediatrician at the UNT Health Sciences Center. And she's going to provide us some insight to help parents be aware of safety with television, internet, and social media activities. So thank you for being here tonight, Dr. Robinson. So can you start out by telling us what are some guidelines that parents might use with media when it involves children or teenagers?
Well, thank you for having me, Amy. Yes, absolutely. So we know that for our youngest children, so that's younger than 2, we actually discourage use of media if at all possible. The only criteria where we would consider it reasonable is when we are using it to promote relationship with family members. So maybe doing a video call with family that live out of state or are out long distance for a period of time, and we want it to be co-viewed with a parent. And then when we talk about that 2 to 5 age range, then that's when we're starting to do some introductions to media consumption. We still want it to be very limited, so an hour or less a day, still very much wanted co-viewed with the parent to ensure that it's high quality educational content, nonviolent, and also interactive with the child that's viewing. And then once we get over 5, then that's when we have a little bit more freedom, but we still want to ensure that they are limiting that media consumption to 2 hours a day. And when we talk about media, it's really anything with a screen. So that's TVs, that's computers, video games, cell phones, tablets, pretty much all of those electronic devices count towards that media time.
Can you share with us maybe some of the negative effects that you see when children are on some of these media things you've talked about?
Absolutely, absolutely. So we now know that excessive media consumption using those guidelines that we just talked about can lead to increases in obesity. We know that children that watch more than 5 hours of TV a day are 5 times more likely to be considered overweight. And children that watch more than an hour and a half daily in that 4 to 9 age range are more likely to be obese as well. So we know that part of that is just sedentary time. They're sitting down, they're not moving their bodies, they're not using any calories, but also there's targeted messaging and advertising that's happening during that media consumption. And so there are things that are encouraging the kids to desire and have taste for those high fat, high sugar foods. And oftentimes there's encouragement for snacking and eating while consuming that media. So all of that together seems to be the reasons for the obesity and the weight gain. Second is we know that sleep can be impacted by our media consumption. So part of that is the quantity, and the other part is quality. So when we talk about quantity of sleep, when we have those screens, they have those blue lights that send signals to our brains, telling our brains to wake up and be alert, and not to get drowsy and allow us to begin to get sleepy so that we can sleep well. And so if we have those devices in the bedroom, oftentimes children are not likely to go to sleep on time. Also, if they have those notifications and those apps going, those alerts and those things going off in the middle of the night will often interrupt a child that is sleeping, so they don't get good quality sleep. And then we can think about some of the negative aspects of school performance. So we know that our older children often will say, oh, I can do it. I can watch TV and do my homework. Well, we know that that's not true. They are not good at multitasking. And so that information that they're supposed to glean from their homework or from their assignments just doesn't get put into their memory and into their brain. And so they're just not learning that material well. And we know that infants and preschoolers that are doing excessive media use, we will see delays in their development as well. So that's from language to social skills to even poor attention. And then when we talk about problematic internet use, we know that some children can develop internet gaming disorders, which is where that they are video gaming to excessive amounts that they actually will spend all of their free time online and would actually prefer online interaction over real life in-person relationships. And so that can be quite destructive for a lot of our children. And then lastly, there's just the risky behaviors. So a lot of our social media and internet and YouTube and things like that show risky behaviors happening. So that can be alcohol use, substance abuse. There can be the challenges. There's some of the TikTok things. And all of those things can often encourage our children to make probably less than wise decisions with how they are choosing to use their bodies and their time. But they can also be targets for predators. And so that's something that a lot of our children don't think about when they're getting on those devices, that privacy isn't quite the same. And so once something is placed on the internet and it's shared, it's often impossible to delete it forever. And it can continually be shared with others. And that can often be exploited by people who don't always have the best intentions.
And what about cyberbullying? Where does that come into play, and how do parents address that?
Absolutely. So cyberbullying is electronic or online bullying, and it includes harmful words that could be in the form of messages that are mean. It could be in the form of embarrassing pictures that are shared about someone. It could even be spreading stories that are untrue about someone. Or it can be excluding someone from a peer group. And so all of those things can represent cyberbullying, and it can have significant emotional and psychological impacts on our children. When we think about the mental health crisis that we're in now, we know that a lot of that has been tied to cyberbullying and what we call digital citizenship that has not been managed well. So what we ask for parents to do is really to be aware of what are all the apps and the ways that their children are engaging online in their online world, and have conversations and interactions with them to let them know that they are loved and they are supported and that they always have someone that is in their corner.
That's perfect. I love that. Can you give us any tips on creating a family media use plan?
Yes, absolutely. So when we talk about how to manage media consumption, really it's about not feeling pressured as a parent to introduce technology earlier than you feel that your child is ready. And so recognizing that you know your child and you know what they are capable of handling. And you can use the healthychildren.org family media use .org, and it will allow you to develop a plan that is tailored and individualized to your child for their developmental needs, and it allows you to set some boundaries. So one, for example, is just like I mentioned earlier, being aware of what are the apps that are being downloaded by your child and how often are they being used and when are they being used. One is having boundaries, or what are some electronic media-free zones in your home? Is it going to be the bedrooms when they're going to sleep? Is it going to be the meal time so that they have time carved out to share and connect with other family members? Is it going to be having a nightly routine where they can unplug for an hour before they're ready to go to sleep? And just remembering that your opinion as a parent and as a consumer also matters. So you can advocate for your child by expressing your opinion that the violent content that's allowed on a video game or on a TV program is not what you consider appropriate, and you would wish that those manufacturers or those companies or their stations would make better choices when deeming something appropriate for children.
Gosh, it's so scary to think about how easily a child at any age can be compromised from just watching TV or being on social media. So thank you, Dr. Robinson, for that great information. I appreciate you. Our last panelist today is Dr. Fuqua from the Oral Health. She's an Oral Health Director at Cook Children's Center for Children's Health. And she is going to share some information on what parents can do to keep children safe when playing sports or even playing on the playground. She's also going to share some information about what to do and when to go to the emergency department for a dental emergency. So welcome, Dr. Fuquay, and thank you for joining us tonight.
Yes, thank you, Amy.
So parents might not be aware of the hidden dangers when kids are playing sports or even playing on the playground. So what would you like for parents to know about child safety from a dental perspective?
Great. Well, thank you for having me. I appreciate it. I love being a part of this conversation. Unfortunately, most of the time teeth are not thought about with being connected to the rest of the body. So I always am very excited when we get to talk about teeth with any topic matter when we're talking about the health of a child, because that is a part of their whole health. So anyways, I'm excited to be here tonight. And a few things I want to start with. I'm going to get to some practical things, but I think a few things that I wanted to start with are some statistics. Yeah, statistics are boring, but I think that these are numbers that people don't realize. Oh, wow, that's actually bigger than I thought. And this can happen to me. So I'm going to share some national statistics. So there was a great research done and found by the National Institute of Health and kind of in conjunction with the American Academy of Pediatric Dentistry. So they did a 17-year study from 2000 to 2017. That's pretty long. You don't typically see that kind of database collected. But the injuries that were most common were obviously, and I say obviously, but you'll get it, obviously within males. The males had a higher percentage rate of injuries in children. Yes, Dr. Guzman, you could probably say that was some other stuff, but males had a 69%, almost 70% higher rate than girls, than the females. And then children 7 to 12 was the highest range percentage at 45% of that age group that gets injured in different activities. And then the highest activities, again, this is national statistics, bicycle injuries were at about 29% with dental, okay? Kids on bicycles injuring their mouth, right? Playground equipment, which can include trampoline or playground type of equipment. And then baseball, softball was the next highest percentage at about almost 13%. So I just wanted to share some of those statistics to kind of give you a perspective and to wrap your head around, wow, this happens all the time. Matter of fact, this happens every 2.5 minutes. A child is injured on a playground. And about 5 million teeth on average are knocked out per year. 5 million. That's a lot of teeth getting lost by children inadvertently doing something very innocent. They're playing sports or playing on the playground, whatever they may be doing. So people, one of the things that I think most folks think about is, wow, mouth injuries can happen with football, wrestling. They think of some of these sports that are so obvious that most people would be wearing sports guards anyway. Ice hockey, wrestling, football, field hockey, lacrosse. Those are some of the highest sports that they will mandate mouth guards being worn, whether it's organized sports from a school setting or organized sports within a select club group or something like that. But what they don't think about is basketball, baseball, soccer, those things that our kids are playing the most. And I will tell you from a personal perspective, being a dentist that sees all ages and predominantly see children, but probably the two sports that I see the most with injuries is baseball and basketball. Basketball, elbows are going. Kids are getting hit in the mouth and they're not wearing mouth guards. Again, the other one is baseball. Ball pops up, hits them straight in the mouth. Bats get thrown, boom. Kids are sliding into base and they eat it. They face plant as they're sliding into home base or whatever. So these injuries, these are sports that are high activity sports, but people just don't always think about with wearing sports guards. I do want to say that though with sports guards, and you may be wanting to ask me this, Amy, and I may be rolling your thunder of some of your questions, but one of the biggest things I think I get asked with sports guards is, well, what about those sports guards that are kind of over the counter that you can buy at the store, at Walmart, Academy, whatever, those boil and bites, right? You put that material in something soft, you put it in your mouth, kind of shape it a little bit, and you use that. Those are not as effective. Statistically proven that those are not as effective as a custom-made mouth guard by a dentist. However, wearing a mouth guard, something in your mouth to protect versus nothing, parents, I'm going to take that over nothing any day. So please, I would rather you do a boil and bite than do nothing at all. The other thing is with kids, unfortunately, kids are growing so fast. Their teeth are changing. They've got small teeth, big people teeth. Oh, some small and some big people teeth. They've got, a little bit of everything. They're losing the teeth, especially in these age ranges of when they're really starting kind of to do organized sports of some sort. So a custom mouth guard gets a little costly. I do have to admit that because you're getting it changed more frequently. Custom mouth guards are fitted better, so kids will wear them more because they're more custom fit to their mouth. The boil and bites are bigger and thicker, not as comfortable. Kids won't wear them as often. They can't talk with them as well either. So if they're trying to run and talk on a certain sport, kind of like my own child that plays soccer that hates to wear the mouth guard, she's like, I'm trying to yell at my teammate and I can't say their name. And I'm like, well, then you practice with that talking more. As they get older and their permanent teeth are in, then going to those custom mouth guards are much more effective and efficient, and not as costly because it will last, right? It will stay. And then kids with braces. Oh my goodness, big injuries with kids with braces. It's a blessing and a curse at the same time. Those braces, you get hit in the mouth, man, it causes a lot of mouth injuries. And I'm sure Dr. Guzman has probably seen his own fair share of mouth injuries in the emergency room. But
and my own kids.
Yeah, exactly. And the mouth is very vascular. There's lots of blood flow happening in the mouth region. So things will bleed real easily. Parents get really freaked out and very scared about things. And I understand because it's bleeding profusely and it's very scary. So one other thing, though, that I wanted to say, about the mouth guard is the fact that when the braces are on, if a patient gets hit pretty hard with the braces, it can cause pretty good damage. So wearing a mouth guard is even going to be much more helpful because you don't have all those brackets and wires and all that stuff. The beauty, though, of those braces is it holds the teeth in place to a certain degree, right? They're already connected. It's almost like they're splinted in a way together. So that's the blessing part of it. But the curse is you can actually have extra injury because of it, or split a lower lip from the braces or something when they kind of bite in or bite down or something like that. So I did want to just, talk about those things with the mouth guard. Amy, if you think of any other questions with mouth guards, let me know, because I do want to talk about what happens if a tooth gets knocked out. So
I think you answered the questions that I was going to ask you related to the mouth guard. So thank you.
Okay, no problem. Well, I know we're getting close to the end, so I wanted to quickly get the information in there. So custom mouth guards, again, are great, but boil and bites, do that versus nothing at all. Okay. Now, as far as those mouth injuries, those severe, something like that, let me talk about a couple of different things. One is, let me make this very clear. If a kid gets a mouth injury where a lip is split open, things are bleeding profusely, jaw, mouth, you see something outside of this area that's, pretty good, you need to go to the emergency room. Y'all need to go see Dr. Guzman. You need to go to an emergency room if it's something that bad where you're looking at it and it's just super scary. Okay. I'd say go straight to the emergency room. The one thing I do want to say though, with mouth injuries, especially teeth, dental injuries, is our emergency departments are not set up with dentists there all the time. And so if a tooth is completely avulsed, meaning a permanent, especially permanent tooth, because that's the last tooth God gave you, right, in that spot. So we want to save that as much as possible. A permanent tooth, if it's avulsed, meaning completely comes out or comes out quite a bit, that tooth, you need to get to a dentist ASAP. Love Dr. Guzman, but a dentist is who's going to save or have the best chance of saving that permanent tooth for you. I want to say, if you're out on the playground, parents, if you're out at a sporting event, you're at an activity, the kids are at a friend's house, whatever, you're at your own home. If a kid knocks out a tooth and it's in your hands, that kid needs to stay moist. The two best things to do is to have the kid kind of not a big spit, but let some saliva go into a cup or a baggie and put that tooth in there and let that tooth stay in there. Don't scrub the tooth. Don't wipe off the tooth. Don't do anything. Pick it up off the ground. If it's on the ground, I don't care if there's dirt on it. Pick it up. Don't rub it. Don't do anything. Put it in the kid's own spit in a cup or a baggie. Or milk. Milk is the next best thing after saline, but most people do not carry saline around with them. So most people in their home or somewhere close will have some milk. But the kid's own spit can go right into a cup or whatever, put the tooth in it, transport that to the dentist, call the dentist immediately. Every dentist should have after-hour numbers, but your best chance to get that tooth back in, splinted and kind of held in, it is the best chance to get to a dentist to do that. At the emergency room, they'll have to call the on-call dentist. By the time the dentist gets there, by the time they get heard, by the time they get to the hospital, a lot of time has gone by and your chances have decreased on the vitality of keeping or saving that tooth. Okay. So, biggest thing I could say about the teeth is make sure you keep it moist and transport it in, I hate to say it, just spit, transport it in spit or transport it in milk so that it stays moist and wet and so that a dentist can take care of that. Okay. I hope that those are some great points to kind of help everybody with thinking about trauma and teeth and how you can kind of help them be safe and healthy and all that good stuff.
Thank you, Dr. Fuqua, for sharing that great information and really connecting our safety and injury prevention with children. I really appreciate you being here tonight. Actually, I appreciate all of you. I appreciate your time. I appreciate your expertise and everything that you have brought here today for everyone to learn all these fabulous things. We have a few minutes left, and so I wanted to open it up to see if there was any questions that you guys might have to ask any of our panelists. If any of our panelists have maybe a few things that they didn't get to say that they might want to add, please feel free to do that as well. Dr. Guzman, I know you always have something to say.
I was just about to say, I'm not going to speak anymore because I've talked enough, but I will say for Dr. Fuqua's tooth coming out, that I can put a tooth back in if I need to quickly. So don't despair that if she's not available in that instant, I will put that tooth back as quickly and then call her so that she can come and splint it as fast as she can.
I'm glad that you say that you will do that because there's not a lot of ER docs that'd be willing to touch the teeth.
Well, surprisingly enough, at Cook, because that's one of our highest priority patients. So when somebody comes in with a tooth that's avulsed, and it's a permanent tooth. They're almost no different than somebody who's extremely injured. They will get to a room quickly, and we will be there to evaluate that patient and put that tooth back. So I'm glad we're doing the right thing.
You are, because time is of the essence in that particular situation with an avulsed permanent tooth. Now, there's parents that get really nervous about a baby tooth, and we aren't necessarily as concerned about that. But right. I will say, if anybody goes to the emergency room for a dental type visit of any kind, pain, trauma, whatever that may be, always follow up with a dentist, always, to make sure that, all the bases are covered, because the ED docs, they are phenomenal and they do a lot, but they're about the emergency, what's happening right then, and following up with, just like they would ask you to follow up with a physician or a specialist of some sort. Same thing with the dentist.
I'll just add, I am not a dentist, so I can't fix those other things. I didn't go to school for that, so I can put the tooth back. But you're right; it really, I am not set up to be able to do all the other things that you guys do so wonderfully.
Great teamwork.
Absolutely. We have a fabulous team. I appreciate all of you. Listen, I learned a lot on here tonight. Dr. Fuqua, I worked many years with Dr. Guzman in the ER, and never have I heard about the spit with a tooth. So that was, I didn't know. I've heard about the milk, but I didn't know. So lots of things, Dr. Robinson, I learned lots from you tonight. There's just so much valuable information, and I appreciate, and I hope that all of the family members that are on here tonight take all these tips with you. So thank you again for being here. Elaine, I'm going to turn it back to you.
And I'm not for sure who will answer this one, but there has been a recent report of melatonin in the news, melatonin poisonings in the news lately. What is that for those people that may not know? And what are the symptoms and what should be done?
So there is a study that showed that poison control centers in the U.S. did receive an increase in calls regarding melatonin. And of course, for various reasons during the pandemic, our schedules changed. We were at home more often. People started using supplements and medications more often. And so melatonin is actually a hormone that occurs naturally in the body, and it's sometimes used as a supplement to help people sleep. It comes in gummy forms. It's usually flavored, and it can be very attractive to kids. Often parents who use melatonin are maybe incorporating a nighttime routine for their children, and so use melatonin temporarily. It's usually recommended to start out with a low dose. Of course, being a supplement, they're not usually FDA regulated. And so with melatonin and people using it more to help them sleep, not sure exactly for some of those reasons why people have had an increase in using them, but we did see that more children were getting a hold of it, maybe because of improper storage or improper use. And of course, like I mentioned, they're highly attractive to children, usually in gummy form. They taste really, really good. Yeah, it actually, a little bit melatonin, so an accidental ingestion of some melatonin is not going to be a huge problem. But of course, like you can see in some reports, it can be quite harmful in large amounts. Yeah.
Okay. Thank you, Elizabeth. I appreciate that. I know this one is for Dr. Fuqua. Dr. Fuqua, I've heard people not really sure about fluoride. Are there any concerns around fluoride, and what should a parent know?
Well, fluoride, I know there's a lot of stuff on the internet. So I always say, please be careful of your sources of where you get your information. Don't go to Dr. Google. Please go to reputable sites to get information. But, fluoride is naturally in our water typically, and they typically try to make sure in most cities, but not all, are not passed to have fluoride in them. So fluoride is in our water. Fluoride is not necessarily seen. We do not prescribe fluoride supplements very often unless somebody is on well water or something else like that. So our pediatricians are really good about knowing and seeing the families even actually before we do as dentists and know and may prescribe fluoride drops or something like that. It's really important for the development of teeth. and for their strength of the teeth, just like, vitamins or anything, minerals would be. That's very important for the fluoride. The one thing I do say, though, safety wise, especially with poison control and the topic we're talking about now, is just like other things that come in gummies and fun, wonderful flavors, fluoride does come naturally also is in toothpaste, which is fine, but that's why we say rice size amount of toothpaste for, a toddler. And as a child gets, above 3 and 4 and older to more of a pea size, we don't have to have the beautiful commercial size swish of toothpaste. The small amount is great. We do not want a kid sitting there squishing a whole thing of toothpaste and ingesting it. But really, unless they did an awful lot, they wouldn't even necessarily have to call poison control, because that kid's going to throw up probably pretty soon. A certain amount of fluoride, if ingested and drank, they'll throw up pretty quick. That's usually kind of the factor that happens. But always, when you're not sure, call the poison control number, or call, even our emergency rooms do have numbers to call the emergency room to ask an on-call nurse just a question. Even something like that is even helpful. But ingesting even a bottle of fluoride that's bubblegum flavored for a kid, it's not going to hurt them for a thing like that to drink. It's going to make them sick. It's going to make them sick is what they're going to do, and they'll throw up, which is good.
May I add something? You heard that kids will likely throw up, but don't make your kid throw up if they do eat plenty of it. So don't induce vomiting, because you can actually cause more harm than good, just even with any poisonous substance or anything. But yeah, thank you. You can call the poison control just for peace of mind. Often our callers are parents who are freaking out, and most of the time our poison information specialists are kind of just walking that parent through how to stay calm. And so, peace of mind is priceless. And so is calling the poison center. So.
Yes, I have called the poison center myself, and I am a doctor, a dentist, and know about medications and drugs and stuff like that. But I still, especially when it's your own child as well. Yes. But my own nephew bit into the little light up pop wrist light up things. Oh, yeah. And then he smiled, and everything in his mouth was quite neon. Yes. So I have called many a times for certain things. So glad y'all are there.
And Dr. Guzman, this is for you. I know there's a myth out there about just because there's not a gun at home, that parents don't have to worry about a kid finding one. Is that true?
That's a myth. Kids can find guns, unfortunately. And when you think about last year alone, almost 40 million guns were sold in our country. There are over 400 million guns that we know of in our country. So guns, unfortunately, can be found anywhere, whether it's school. And you hear stories ever so often and then just recently in my own backyard of a 7th grader taking a gun to school. And so you can find guns anywhere. And so that's a huge myth. And we want our kids to be prepared, right? You want to make sure they do the right thing and they injure themselves. And they call the right person to come and secure that, but they should never, ever pick up a gun, touch a gun, because how unsafe it can be.
I just want to say thank you to all of you. Again, Amy was a great moderator. You guys have been great panelists, and I really appreciate the time and what you all have brought to this conversation today. And I just appreciate the fact and the work that you do and bringing the children, families, the communities to help improve the overall health and well-being of children in our community. That's a win-win for everybody. And that's the goal at the end of the day in the work that we do, because we want to do prevention. And, that is huge. Thank you all, and have a great rest of your evening.
Thank you.
Thank you.